Hello, my name is Bruce Miller. I am a Senior Scientific Director at the COPD Foundation. In this Research Innovation Update, I am going to talk about the lung microbiome and why at the COPD Foundation, we believe an understanding of the lung microbiome is important and provides exciting and novel opportunities to improve the management of COPD patients through a better understanding of their disease, and also provides opportunities for the development of new COPD treatments. Although there are effective treatments that help COPD patients breathe better and reduce the risk for exacerbations, many patients with COPD continue to experience a high burden of respiratory symptoms and a deterioration of their lung condition that impacts important aspects of their daily life and also increases the risk of dying. In many COPD patients, changes in the lung microbiome may contribute to disease worsening. So what is the microbiome? Every surface of the human body that is exposed to the outside environment, including the gut and respiratory tract, contains a large collection of microorganisms such as bacteria, viruses, and fungi. This collection of microorganisms is collectively called the microbiome. Together, these trillions of microorganisms can weigh up to 5 pounds, more than a human brain, and can have a significant impact on health. In each of us, the number of bacterial cells actually outnumbers the number of human cells. Even in healthy people, the lungs contain a variety of bacteria that normally do not cause disease and may be at least somewhat beneficial by helping to keep in check bacteria that may do harm. In the lungs of many people with COPD and other chronic lung diseases, because of the lung damage that has occurred, bad bacteria or pathogenic bacteria are able to thrive. These bacteria and how the body reacts to them can negatively impact the course of disease in people with COPD and other chronic lung diseases. Recent research studies have found that the presence of the so-called bad bacteria in the lungs of COPD patients is associated with increased respiratory symptoms, such as cough and mucus production, and poor clinical outcomes, including increased frequency of COPD exacerbations and death. The presence of these bad bacteria is called dysbiosis. Dysbiosis can occur at all stages of COPD, but is more common in those with more severe disease. The amount and type of these bad bacteria varies between different patients. Although there are no currently available treatments that can correct the bacterial dysbiosis in the lungs of COPD patients, an understanding of a COPD patient's microbiome and the differences that exist between patients can provide helpful information to inform patient care, including selection of appropriate treatment options. Furthermore, while the pathology of COPD and other respiratory diseases involves the upper and lower respiratory tract, systemic immune responses and pro-inflammatory effects also play a key role in disease occurrences and severity. Along with the lung microbiome, the gut microbiome is altered in many respiratory diseases. And it has been found that the gut microbiome and the products produced by bacteria in the gut can have an important role in immune responses throughout the body, including the lung. We are learning that the interaction between the gut and the lungs may be important in chronic lung diseases. This linkage between the gut and the lung, the so-called gut-lung axis, offers additional opportunities for better understanding and treating chronic lung diseases like COPD. An example of this is illustrated by a recent report that alterations in the normal gut microbiome may be a contributing factor to the development of symptoms and the consequences of long COVID in people that have had COVID-19. The COPD Foundation, through our COPD 360net research initiative, is using the information on the lung microbiome to help us explore new treatment opportunities and determine the patients that are most likely to benefit to impact outcomes important to patients.